Hey, it's Dr. Rob with your 2-minute tip this week designed to make you feel better and live better. Today we're going to be talking about foam rolling your entire lower body. Now the foam roller is what I call the toothbrush for your muscles. It's something that you can use every single day and it makes all the difference in the world in terms of how you feel and move, and really magnifies the effect of the treatment that you're getting even with your therapist. Your foam rolling is relatively simple. We're going to kind of work up our body, but we're going to start in the calf muscles. The calf muscle is one that a lot of people go, I have to lift my entire body up, and it's really, really hard. That is actually untrue. When you're doing your calf muscles, all you're doing is you're going to go find a spot that's a little bit tender. I'll actually use my other leg to weight it down and push it down, and you don't even have to lift up. You're just going to kind of wiggle back and forth. Now I'll often turn into the inside to get the inside of the calf, or the outside of the calf. Really what you're doing is looking for the most tender spot. So what I say is, I call it search and destroy. You're gonna go in and go, ooh, that feels a little bit painful, a little bit uncomfortable, and you're just gonna spend a little bit of time on this, okay? One of the major reasons people don't foam roll is because it hurts. It hurts because you need it. If you foam roll every single day for like 2-3 minutes, it'll stop hurting, okay? So we're doing our calf. Then what we're going to do, you can work up into hamstrings, okay? Same idea, hamstrings pretty easy. You're going to go in, find a spot that's a little bit more tender, okay? And I'll often do one at a time because you can get more pressure on it doing that. But again, you're just kind of leaning back. You don't have to hold your whole body weight up. If you really want to get fancy and hard, you can put a little bit more pressure by crossing. And it's just a little bit of movement. You're not doing like super long, crazy movements. Once you've found that spot, you're just going to kind of wiggle back and forth on it, okay? The other spot we're going to do is our hip. Now, when you're doing the hip, I kind of, pretend you're sitting on a campfire log. You're going to go one hand back. The easiest way is to straighten that bottom leg and cross over, because now what you're doing is you can just kind of go in and hit whatever spot. Again, if you want to turn to find this spot, and again, you're just looking for wherever it's tender. Often you'll have to get a little bit higher up, closer to the belt, and you go, ooh, that's a good spot. And again, just a little bit of wiggle room with your top foot here. You're just going to push back and forth doing that. The other spot on the lower body that we want to roll is the front of your thighs or your quads. Again, I like to do one leg at a time because you get a deeper pressure, but all you're going to do is get in through there. Again, look for a tender spot and just using your arms to kind of wiggle back and forth. You don't have to put a lot of pressure. I'll use my other leg up just to kind of support and kind of go back and forth, okay? If you do this on a regular basis, you will start to notice a massive difference in how you feel. The muscles become more pliable. Again, it's like brushing your teeth every single day. It's going to make you feel really, really good, okay? Try this out. If you have questions, ask your therapist. It's one of the most common things we recommend to continue to feel good on your own, all right? Have a good weekend.